back. This is Boomer Life on CL 650.
Welcome back to the program. Our guest is the surgical director at FalseCreek Healthcare Center downtown at 555 West 8th Avenue. Dr. Kimit Rai is with us, and our program, obviously, dedicated to cosmetic surgery. And Dr. Rai, you've talked to us a lot about anti-aging procedures, facelifts and tummy tucks and that sort of thing. What happens in a facelift? What actually gets lifted?
In the facelift, you assess the patient to see exactly what they need. They may have jowls on their face. They may have called marinette lines. The skin in the neck may be loose. The temple might be loose. So we basically do is we make an incision in the temple and go in front of the ear and go behind the ear, and then we separate the skin, and then we have the tissue called the deeper tissue, which is loose, which is basically the part that is creating the jowls. So we need to tighten that tissue by pulling it up and up and forward, so that we can tighten. It's called smash tissue, where we put stitches and adjust it so that the deeper tissue is tightened, and then the skin is then redraped onto the surface, and the excess skin is resected. So it's a longer procedure, and involves combination of not only taking skin away, tightening the deeper tissue, but sometimes also using what is called fat grafting, where we harvest some fat from the tummy and then provide fullness of the face at the same time. So it's a long procedure, could run anywhere from 3, 4, or even 5 hours.
And I guess the real secret to making this a successful procedure is in the placement of the stitches and the avoidance of scarring, correct?
Yeah, to minimize the scarring, and then, you're right, and then making the proper decision and positioning of the suspension and support that you've created on the face, yeah.
Okay, and eyelid surgery would be a sort of a micro version of what you've just described, right?
That's right. We'll be taking some skin away, addressing some of the fatty pockets that are there to give them the youthful look, tightening the lower eyelid called the canthus, and the lower eyelid, the skin resection is very minimal, but the shaping is the one that gives the youthful look by trimming the upper lids and the lower lids together, yeah.
Okay. Now, this next one I want to ask you about is the one that we know the most. Everyone knows the phrase, a tummy tuck.
Yes.
And we all kind of think we know what that means. But I'm willing to bet dollars to donuts. If you asked most of us, we really wouldn't be able to describe it too terribly well. So what, Dr. Rai, actually is a tummy tuck?
A tummy tuck is one where the skin is undergone below the belt line. The skin is loose, and the person is uncomfortable looking at themselves. They don't look well.
Right.
So they have muscles that are weak, and the tummy is bulging. Many of them achieve the desired position of their weight, and you find that the excess skin in the lower abdominal tummy part is removed, and then the underlying muscles called the rectus muscle is tightened up with stitches to narrow and tighten the waistline, and the belly button is readjusted. So you're doing 3 parts to it. One is removing skin.
Right.
You are tightening the muscles and then repositioning the belly button, and maybe complementing this improvement with a little liposuction to give them the waistline and shape, yes.
Does a lot of the tummy tuck work come after an individual has lost a fair bit of weight? Is there a preamble to the procedure that would involve exercise and diet and really getting down to that as close to the ideal weight as possible?
That's true. I think most of the patients who come in on the ideal weight position, and especially men, they would have lost the weight and come in, and women as well. Yes, there's no point doing that procedure if the person is, not in the right position of achieving their goal. Like they still have got fair amount of weight to lose, and the tummy is full. There's a particular what is known as body mass index, depending on the right. You have to be at the right weight and the right position to recommend the surgery to get the best outcome.
Of course, yeah. Now, I wanted to ask you, again with Boomer Life in the back of my mind here, because there's another procedure that would be, appealing, I think, to some members of the audience, and that's a breast lift operation, because beyond a certain age, for some women, this becomes an issue of concern, doesn't it?
Yes, that's true. Breast lift is a popular operation, especially women that have breast fat and the breast drops, has undergone atrophy and the breast is deflated. So
how does that get fixed? What do you do?
We do call a breast lift, where we put in either a scar around the nipple only, or we put like a lollipop scar, and then we tighten the breast and put a plus or minus an implant sometimes. And if that might, some women don't like implants, so we just do the lift without the implant.
Right.
The lift seems to stay, but not long enough sometimes. But with an implant, they have a longer position of getting a nicer result sometimes. And so these decisions are made after consultation with the patient, yes.
Right, and is it becoming a more popular procedure?
Yeah, it is quite very popular, yes. We do a fair number of them. And many women who come in for breast augmentation, pretty well, many of them do need a breast lift at the same time. So we do discuss that with them at the time of their consultation.
So even though I'm sort of framing some of my questions in the context of boomer-aged people, really, on an individual basis, there are no age limits for some of these procedures, are there?
That's true, yes.
It depends on the individual body type, right?
Body type, health-wise, the status, and lifestyle status. And to me, that's what we see. If a person is not healthy, has got issues, they're not good candidates. You make them aware, especially very heavy smokers, where healing will be a problem, things like that. You discuss it with them.
Right.
Many of them will quit smoking and come back and see you and have the surgery.
Oh, interesting.
Yeah.
And so, in some cases, I would imagine it would be a condition of the procedure going forward. You better quit smoking, or this just isn't going to work for you.
Yeah, that's true. If they're heavy smokers, we warn them and tell them the healing will be slower and the scar is not going to be healing properly. So if you're prepared to take that risk, it's an option you have to consider. However, we would recommend that you give up smoking and come back and see us, and then consider your surgery later.
Also, on the matter, I'm bouncing around a little bit, but you've mentioned this particular word a few times, and I didn't get on it when you talked about tummy tucks a few moments ago.
Yeah.
What is liposuction, Dr. Rai?
Liposuction is a procedure where we basically reshape the body by contouring the body by removing fat in the wrong places. So.
And I suppose I have a real civilian's view of what, in my mind's eye, I see the surgeon with some kind of tiny vacuum that goes in and just actually it sucks the fat out of certain cavities in the body. Is it that simple?
No, it's not that simple. It's basically reshaping. You don't just take fat out. You find out where the areas are, you look at the body frame, and you mark the areas ahead of time.
Right.
And then you decide this is the areas that need to be shaped, so you redistribute the fat, or you remove fat, and then you move it to another location. It's called body sculpting more than liposuction.
Okay, and so it's the marking of the body. Now we've all seen this on television, where the patient is lying on the table, and the surgeon is standing, and you can see marks like magic marks on the body, where this is going to happen here, and over here we're going to do a little bit of this, and you make a line, and we're going to do this, and you make a line. That's probably really an important and integral part of the education process as much as anything else, isn't it?
That's correct, yes. We need to reshape the body, so we pick up the areas that are overloaded with fat and remove it, or maybe redistribute it. Have to see exactly what the patient's body form is, yes.
And also, though, but in terms of the education of the patient as to, well, we're going to do this and we're going to take it away from this area because, and you fill in the reasons.
Yes.
What is a follow-up to one of those procedures? How would it differ from any of the other procedures?
It will be the same. You'll be following up in a week, and 2 weeks, and 1 month, and 3 months to make sure things are going, and many of them are happy. The couple of areas that might need a real little touch-up, we discussed that too. So.
Right.
So we keep an eye on them at least up to 6 months to see things are coming along.
And when one has one of these body contouring procedures, Dr. Rai, yes, whether it's a tummy tuck or liposuction or a combination of those and more, at what point does physical fitness, the need to exercise following the healing process, when does that kick in?
Well, they can start exercising. If you're only having liposuction done, you can start exercising fairly early, within 2 weeks. If you're having a tummy tuck, you need to heal completely by 6 weeks. But
okay.
You can start walking around in about 10 days or so, yes.
Right. And is it important to the wellness of the patient that an exercise program is part of the recuperative process?
Well, it's true, yeah. Most of them who come for the surgery in the first place are already motivated, so they do take care of themselves.
Right.
That they know that it's a wholesome treatment, not just an operation only.
Well, that's quite interesting because that has come up in many of our conversations with your colleagues at FalseCreek Healthcare Center over the recent months, Dr. Rye. The fact that at FalseCreek, patients tend to be highly motivated.
Yes, they are.
And that would be because they're going out of their way to seek out the kind of direction and the kind of medical assistance that only you can provide.
That's true, yeah. That we do discuss that quite extensively with them, yeah.
Interesting stuff. False Creek Healthcare Center, by the way, is online at FalseCreekHealthcare.com. And if you want to take a moment and check out that website, I will take a moment and take a quick break, and we're back with Dr. Rye in just a couple of minutes.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.